Ever pondered the challenges of diagnosing interstitial lung disease or ILD with traditional methods? The medical community has long grappled with these issues, and today we delve into them and discuss a promising alternative. Interstitial lung disease is a group of conditions that cause scarring to the lungs, making it difficult for patients to breathe and get enough oxygen into their bloodstream. Diagnosing ILD is a complex process, traditionally relying on surgical lung biopsy, or SLB, often considered the gold standard. This invasive procedure involves removing small pieces of lung tissue for microscopic examination. Yet, as precise as it may be, surgical lung biopsy is not without its drawbacks. The invasive nature of the procedure means it carries a risk of complications, such as bleeding and infection. It also requires hospitalization and chest tube drainage, adding to the patient's discomfort and recovery time. But what if there was a way to achieve a similar diagnostic yield while reducing the patient's burden? Enter the less invasive transbronchial cryobiopsy. A recent randomized trial has suggested that starting with this procedure can significantly reduce the need for chest tube drainage and hospital stays compared to immediate surgical lung biopsy. This step-up approach with transbronchial cryobiopsy first is emerging as a viable alternative. It uses a bronchoscope to obtain lung tissue samples, causing less trauma to the patient. While it may have a slightly lower diagnostic yield, the balance of procedural complications and diagnostic accuracy shows promise in reshaping the landscape of ILD diagnosis. To summarize, interstitial lung disease has traditionally been diagnosed using surgical lung biopsy, a procedure that, while effective, carries risks and discomfort for the patient. However, the advent of the transbronchial cryobiopsy offers a less invasive yet still effective method. This approach not only decreases the patient's hospital stay and need for chest tube drainage, but also minimizes the risk of complications, making it a promising alternative in the world of ILD diagnosis. As we continue to advance in the medical field, the balance between diagnostic accuracy and patient comfort remains a priority. And with options like the transbronchial cryobiopsy, we are moving closer to achieving that balance in the diagnosis of interstitial lung disease.